The St. Luke Catholic Hospital is one of the referral centers for accident cases, particularly on the Accra-Cape Coast Highway. The hospital is located in the Apam community in the Gumua West district of the Central Region. Aside attending to accident cases from the stretch, it also has the oversight responsibility of taking care of patients within Apam and its surrounding communities. Since 2019, the hospital has been without a functioning plant as a backup support in the unlikely event of power outage. Speaking to City News after Ghanaian psychologist from the United Kingdom, Dr. Anigezi, paid a working visit to the facility, Father Francis Otindomfe, administrator of the hospital, highlighted their challenges with regard to the lack of plants.
On a regular day, the challenge comes, there is also the national agenda of going paperless. And we want to join that agenda. But when the light goes off, you have no choice but to fall back to what we are trying to move away from. That's the folder or the paper system. So a lot of surgical cases are referred here. But when you have no power, you can't render that service. And when, let's say we have an accident case, RTA, and they will need to take people to the theater and there's no lights, you can be sure that the only option will be to refer the patient. And once it comes to emergency, time is of essence. Sometimes when the patient is being referred, it comes at a cost to the patient. And that cost could have been avoided if we had a plant here. So if you have to refer a patient to maybe CCT, to Winneba, to Kolebu, where that thing could have been done here, as a result of the lack of a backup power, the patient will have to bear that cost of the movement. Healthcare is a collective responsibility, and we shouldn't only be looking at only governments. So we will passionately appeal to corporate organizations to our aid by providing a plant to serve as a backup when electricity is off.
Not only is the facility struggling with access to a plant for efficient electricity, but their proximity to the sea is also a challenge as medical equipment easily corrodes.
We are just by the sea. The rate at which the sea breeze can do damage to digital equipment. And now that healthcare is going towards good diagnosis, sharp cutting edge for doctors to take decisions, you cannot be out of that. But when we bring such equipment here, the sea breeze reduces its lifespan, and so at almost every now and then, we are replacing equipment of one kind or the other and maintaining almost everything that has a metal component. That is our major headache.
Health workers here in Apam say it will be difficult taking care of patients if the plant behind me is not replaced. Workers have on several occasions complained about the non-functioning plant, which is making it difficult for them to take care of patients. There are also the issues of corrosion taking place as a result of their proximity to the sea. They are, however, hoping that help will come soon. Calvis Tete, City News, Apam.